Thank you for joining us this morning, or this afternoon if you're on the East Coast, I guess.
Or if you're in Australia.
Well, first and foremost, we want to thank all of you for joining us here today. Whether you're here in person or you're joining us online, we're happy to be able to have this community event during our annual campaign of Sleeptember. We're happy to have the patients that are participating today with us, the doctors and the subject matter experts. We want to thank all of you for joining us today. We have a lot of our sleepapnea.org staff and board members here. So we just want to say thank you to Valerie Mead and Megan Gramstad, who are manning the front desk right now. I want to tell them thank you for all of their hard work and dedication on the CPAP assistance program and our Awake network. They are the two individuals that you speak to if you call in to our main number. We thank them for all their help they provide to our patients on a daily basis. I want to say thank you to Tina Piazza and Jean-Noel Friedman, who are part of our communications team. They're here today. Thank you very much. All of the wonderful things you see online and our website, it's because of those two individuals. And also give a shout out to Elizabeth Johnson, who takes care of our finances. So she's here today helping as well. So thank you very much to our staff that is here. We have other staff that is helping out online. They are going to be the ones that are answering your Facebook questions and comments, working on Twitter. So we're happy to have them on board, even though they're not here with us in person today. So on the, maybe you could see on the slide here, or for those of you online, the hashtag for today is #AwakeTogether. So if you are participating online and want to make some comments, if you could just use that hashtag, that'll help kind of keep everything together and help our staff monitor questions which can be asked during this live meeting here. Go ahead.
So I'll do a little bit of other housekeeping. I'm Adam Amdur. I'm the Chief Patient Officer of the American Sleep Apnea Association. We asked for those in the room if you could put your cell phones on vibrate or silent. We'd appreciate it. We understand people have to take calls, so just go outside if you don't mind. I want to acknowledge as well as our staff and thank them for everything they've done. We have probably more board members together in the room, which is a new thing for us since we're a virtual board and we're spread out all over the country. So I'd like to thank them for all showing up and being available today, and all patients, and you all will learn that we are patient-driven. I also want to make notion that for any patients that are in the room or anybody that feels like they want to give a testimonial about sleep apnea, about the Awake program, about the afternoon tribute to Dr. Gimeno, we will be doing interviews upstairs with Mark Ostrick, who's an open heart patient, and we've been working with doing all our film and video for the last year. So we invite you all to go up there and give 5-10 minutes of your time and leave your testimonial and where you feel you're at with your disease or what can be improved upon and whatever's really on your mind. So you'll see on the screen, this is our program today. Dr. Sullivan's going to lead us off after Justine and I are done here with greater than sleep apnea and overlapping issues. We'll be running a real-time polling as well during this meeting, which will be a couple questions from our active survey that's online right now that we did with Evidation Health. The second part of the day will be the vision of Dr. Christian Gimeno with Dr. Stacy Kuo and a short video, and they're going to go into and explaining what the multidisciplinary Friday Awake clinic that they've been doing at Stanford for all these years and how we want to carry that forward on a national scale. On the first panel, we'll have 4 patients that have not participated in the Awake clinic before. And on the second panel, we'll have 3 patients that will each be featured that are still haven't optimized their therapy at this point or come to understand their struggle with sleep apnea. We will have a very uplifting after lunch talk, considering we're in the location we're in today. It's a beautiful day. We're in the Presidio in Golden Gate Park in a national park, and the bridge is not wrapped in fog. For a lot of our patients, we are succumbed to cognitive fog and brain fog, and some days we have to burn it off, and some days it's a beautiful, clear day like this in an Indian summer in Northern California. So the lunchtime conversation will be about chronic insomnia and suicide, which is, you will not see in most conferences because it's not a subject that most people want to talk about. But considering that we're right next door to the National U.S. Military Cemetery and one of the premier suicide spots in the world, we thought it was important to highlight this issue and bring the education awareness not only to those in the room, but to our community online. It'll be a little bit more of an uplifting afternoon. Bray Patrick Lake, who's one of the preeminent patient advocates in the country, who was the original patient PI of PCORI, which was the patient-centered outcome research, and has worked with the All of Us initiative, is now working with Evidation Health. She's going to moderate a panel with a couple of really smart, eclectic patients that are on our board, that were on our panel last year, and that are working in the cancer genetic space. Because we as an organization, you'll see through our slides, are collecting a lot of information and a lot of assets, and we want to start to bring it together and compile it so we can tell a whole story for the research world, but also help to change policy, education, and things of that nature. We will wrap up the day by launching the Right Under Your Nose campaign. The acronym is RUN, for Dr. Christian Guilleminault. Dr. Christian Guilleminault, for all of you who don't know, is the man who founded basically the field of sleep medicine. It was based in the Bay Area, literally lived up the hill in the Haight and the Victorian, published 800 papers over 49 years, so it's about 15 medical papers a year. And Dr. Guilleminault unfortunately passed this summer, and he left us his vision and his vision for searching for cures that are literally right under our nose. And when I mean that, that means from here, your nose, in your mouth, and to here. And we will bring that education, and our multidisciplinary, interdisciplinary team will highlight what some of those issues are and what some of those warning signs and things that we should be looking at in our faces. And that will be a very jam-packed, full-day Awake meeting. Everyone should know that Awake is a 25-year-old organization. The ASA has been running it a long time, but it's until the last 7 years, the patients are now running this organization. It's patient-driven, and we've turned Awake into a single intervention sort of education support group for people with PAP devices so that they learn about other pathways, other innovations, other interventions. Nobody owns the airway. Some people walk through the surgeon's office, some people walk through the dentist's office, some people walk through the pediatrician's office, and they're going to get handed different information. Our job as a patient organization is to educate you all in the room, but also those online about what's the best option for them when they go to talk to their doctor. We're very much proponents of shared decision-making, and you'll see this meeting is far from a professional meeting in the light that it's not a paternal-maternal one-way conversation. This is very much a bidirectional conversation. So we ask those in the crowd, if you have questions, if you're thinking it, someone else is thinking it. Please don't be shy, ask the questions, and we'll do our best to give you an answer. Throughout the middle of the day, in the back, you'll see these bar tables, stand-up tables will be our round robin, and each one of those tables has a different specialty. And we ask you to visit with each of the different experts at those tables to learn about possibly implants or cognitive behavioral therapy, or what you could do with your oral appliance, or how you can better manage your CPAP. So these tables and these experts are in the room for you guys to meet with and interact with and to learn as well. And moving on. So,
one quick thing.
Yeah.
One quick thing about the round robin. For those of you here in the room, you have a little card. As you visit the tables, you'll get a sticker. If you fill out your card, you'll be entered into a raffle for today, and our prize is a pair of Birkenstock sandals, so you'll get a gift certificate for that. So just wanted to let everybody here know.
Before I get on with my presentation, we're going to do a test. So if everyone has their cell phones in the room, we're going to show you how the real-time polling works. So you can take part in our polls even if you're watching online. Go to pollev.com/idealsky071.
That's if you're on a desktop.
That's if you're on a desktop. Or text the word idealsky071 to 22333.
So 22333 is the number, and then you text the ideal sky 071, and then you should get a confirmation message.
So if everyone could go ahead and text 22333.
And then you type in your message of ideal sky 071. All right, and then we're gonna call up the poll. So here's the poll. My favorite flavor of ice cream is vanilla, chocolate, rum raisin, or I guess that means calorie-free, option D. So right now, chocolate.
Go ahead.
Oh, you need to back up? Okay.
Can you back me up, Tob? There you go.
One more time.
Text 22333.
That's the telephone number. Ideal Sky 071. Okay, let's go to the poll. Looks like it was working so far. We had 100% chocolate. Oh,
Hey, there we go.
Oh, there we go. Look at that.
So we can see early in the morning, we can see who's sleep deprived, who's had their coffee, and who hasn't.
So we're going to have some of those polling questions throughout the different sessions today. So you can keep that on your phone, keep it on your desktop at that website, and we'll be able to participate with the people online as well with that option. Okay? Go ahead, Adam.
Okay. Video guys, you want me to slide over to my deck? No. Let's back up here. So, the mission of the American Sleep Apnea Association, or as we like to refer to it, sleepapnea.org, is improving the lives of sleep apnea patients. It's pretty simple. Whether you're currently diagnosed, currently treated, not been diagnosed, no matter where you are in the journey, we want to help improve your lives so you have better quality of life outcomes. We do that by understanding this disease, which is what this meeting today is all about, and about lowering the impact of the disorder through research, advocacy, and education, which you'll see a little bit more about our organization in a minute. This is who we are. A lot of people talk about the word patient-centric. We really are. On top of that, I would say we're patient-driven. We're run by patients. We've taken the bias and the conflict of interest of the healthcare community off of our board. We're solutions-oriented, so we're not just complaining about the system. We're actually trying to help provide our patients answers and options about how to improve their quality of life. We're tech-savvy. We've been running a 3-year longitudinal sleep health study on the Apple ResearchKit platform. We have a self-pressure study that we're doing with the VA with our Chief Science Officer, Dr. Carl Stepnowski, looking at CPAP data. We run a lot of online webinars and communication conversations, whether it's in our Awake Health Facebook group, on our Awake Facebook page, on our website, on our forum, on all the social media channels. We try to go to where our patients are at. We know not everyone can come to us. That's why we're broadcasting this meeting today. These are a sort of compilation of all our current initiatives. So in the middle is what we're about. And if you look in the upper left, you can see the education piece. In the upper right, you can see the research projects that we're working with. In the bottom right, you can see some of the advocacy projects that we're working with the FDA on the drug and on the device side, and with other comorbid patient caregiver groups. And on the left, you'll see our direct patients assistance. We've been running the CPAP assistance program for the last 5 years, and we've been able to place 7,500 masks and machines into patients' hands that either didn't have insurance or were underinsured or had no way or means of getting therapy. This is a little bit highlight of the CPAP assistance program. You can see some of the testimonials from some of our patients. Patients who went 8 months after they were diagnosed but couldn't afford a machine and the insurance wouldn't cover it. They came to us, they got therapy, they started changing their life around. And then this past year, we've really done a really good job with Val and Megan, who run our CAP program in Minnesota, where patients now are paying it forward. So if someone passed away, they'll send us their old machine. If they get a new machine, they'll send us their old machine. So we're able to clean these and refurbish these and get them back out to our population so that they don't go into a landfill, and that people that want to get therapy and that want to try the intervention have that option. This is a compilation of an ongoing 3-year sleep health study that if you have an iPhone, you can download on the Apple Store. It's called Sleep Health. It's been featured by Apple for the last 3 years. We still average about 100 new participants organically coming into the study every month. You'll see that we have over 400,000 activity events accomplished over 3 years. We have 91,000 participation days of data that we've been collecting on the Apple Watch from the passive data, from surveys, and from different alertness functions that we have on it. We will be updating this next year. Lessons learned from the original Apple Sleep Health Research Kit were we were very ambitious as a patient group and we threw everything up on the board to see what would stick. We then partnered with Evidation Health and we streamlined the same questions and all the things that we wanted to know on our sleep health kit, but we changed the methodology. We changed how we asked the patients the questions. And you'll see some of these statistics. The retention and the completion rate for surveys is through the roof. You will not see these at medical conferences. We literally asked one daytime cognitive question for 7 days straight, and we're able to get people at over 50% to respond for those 7 days. We then repeated that survey 90 days later, 6 months later, with the same sort of results. So we're learning to not only design the surveys, figure out what's the data that we're looking for, the real world evidence that's important to our patients, but also how to make sure that our patients are engaged, and because everyone gets emails every day to do surveys. This is a survey that's important to us. It helps us advocate to the regulators, to the insurance companies, to the professional societies, and so forth. This is another study that we just did, and the reason why our Chief Science Officer is not in the room, he's actually giving a poster at the National Patient-Centered Outcome Research Institute meeting today in Washington, D.C. And we literally have sent about 150,000 emails and have touched about 400,000 patients all over the country to recruit mobily and virtually 330 patients into a overlap study that we're looking at the combination of COPD and sleep apnea, and we're providing a coaching curriculum to these patients that are going through the study. Now, we actually had to connect with 330 different DMEs. DMEs are the durable medical equipment companies that we as patients, when you're prescribed a CPAP machine, that's where you go to get your machine. And to be able to connect the data, we all are getting the data on our phones and our phones and their summary data, but to actually see the raw data, we're still very far behind the times, and there's still a lot of obstructions and issues in the way that we're going to try to work with the manufacturers to iron out. Because people like to say that the patients own the data. In theory, that's right, but in reality, the DMEs are the stewards of our data right now, and we don't have access to it to the degree that we want. Why are we all here? Why are we in this room? We have a massive public health issue. This is why we have our Awake program. This is why we're running the sleep health study. This is why we're running a national overlap demonstration project. This is why we're providing education on our website, on our forum, and on our in-person Awake groups. There's 70 million Americans dealing with some sort of sleep disorder. 30 of those presumably have sleep apnea, and 80% of those 30 are undiagnosed, or I like to say underdiagnosed or misdiagnosed. They're already in the healthcare system. They're in the cardiovascular offices, they're in the diabetes offices, they're in the mental health offices. And one of our goals and one of our jobs is to make sure that you guys go back and those online, that if you go to your primary care doctor, your specialist, and if they haven't factored in the sleep component, they don't have the full story. And if you don't have the sleep component factored in, you can't manage your life. There's obviously a financial impact of this disease on society, whether it's in transportation, whether it's in work, whether it's in school, and a very low estimate is $100 billion and I would fair to say that. I'm sure we could prove that it's a lot bigger impact right now, especially in light of the 4 a.m. Twitters and stuff like that that we're seeing for the last 2 years. This is a result of our 2018, the first annual Awake Initiative survey. that we did with our community, and we did with a younger, more female-based population that is on a platform sharing their data called Evidation. And you'll see from this the common prevalence and the comorbidities that are associated with this disease, whether it's the heart disease, the GERD, ADD, you name it. Our patients are suffering from all of these things. And whether they understand that or not, or treating that before they're treating the sleep, it's important that we start to look at all these overlaps and we figure out if this is causation or correlation. Now, the common symptoms in that survey: fatigue, daytime sleepiness, dry mouth, cognitive issues. Even if you're on CPAP and you're not on CPAP, people are still having these. So we know the CPAP is treating the breathing, but it's not the final be-all answer for everything else. We need to figure out what's going on with our daytime functioning. Whether that's your nutrition, whether that's your movement, whether it's cognitive behavioral, whether it's sleep hygiene, there are all sorts of ways to improve these other symptoms that we're all dealing with. This is also why we're doing a follow-up survey this year to dig deeper into these questions, and why we're having the real-time polling today, so that our patients online can see some of the survey questions that are in this year's survey and some of the other questions that we're looking to answer. As a result of all the work that we've showed you that we've been doing with multiple studies, with our education, with our CPAP assistance program, the FDA has looked at us and realizes that we're sort of the common glue with a lot of their rare diseases and the chronic diseases. Everyone sleeps, after all. So they've put us in a pilot called the Patient Caregiver Community Program, and you can see there's the Children Network, there's the TMJ, there's the Faces and Voices of Recovery, there's the Michael J. Fox, there's JDRF, Creaky Joints, Mended Hearts, the Kidney Association, the National Association of Caregivers. Caregivers have more problems with sleep apnea patients, because if we're snoring, and our bed partner or someone taking care of them, their sleep is interrupted. So we're not doing good by them as far as their sleep health. And then we're obviously looking at rare diseases. All rare diseases have a sleep component to some degree or another. So I mentioned the survey that we're doing real-time polling today. Here's a snapshot of what we've already sliced from it that's ongoing. The survey will be up online till the end of the month. We've already looked at 2,460 survey participants. Average age of the participants is 44 years old. I think when the survey is over, I think it'll show and it will prove that there are a lot more females with this disease than that are publicly recognized. It's almost split down the middle right now. A lot of these patients have only been shown one intervention. A lot of them aren't even treating it. And then you'll see that last line on the slide, which is very clearly cost is an issue to treatment. And nothing should keep people from treating their sleep apnea, because whether it's you driving or whether it's someone else driving, we're all at risk for cognitive sleep deprivation. So where does this lead us to? And our vision for the future, and what we're going to do this afternoon in honoring Dr. Christian Guilleminault, is we have an emerging pediatric health crisis. We have an overweight epidemic that's talked about regular in the news. We have a strong overlap causation correlation with attention hyperactivity, ADD and ADHD, and we are having a major impact on these children and how they're developing neurocognitively, failure to thrive with growth, socially, in school, and performance in school and on the athletic field. Right now, we have 4% of the children in the country probably diagnosed with sleep apnea. I'm sure some of the doctors in the room would probably say that number is a lot higher, and just because of the standards of what constitutes a sleep apnea, children don't necessarily hold their breath for 10 seconds, so that they don't always score as an event. So there's a lot more of what we call sleep fragmentation and sleep disorder breathing way earlier in this prevention, and you're going to see a lot of conversation today about getting further upstream in our prevention and the interventions for this disease. We feel that sleep apnea is the end of the road. Our mission is to make sure that no one ever gets to sleep apnea. We want to help our community that's struggling with it right now, and we're trying to provide all the resources. But our target and our vision is to look for cures for pediatric sleep apnea. There's a big myth out there that pediatric sleep apnea and adult apnea are two different things. You'll see from Dr. Sullivan today that they very much are one and the same. We evolve, and this has evolved since we're young. It literally evolves right at birth. So that leads us to what we'll be doing this afternoon in honoring Dr. Gimeno in the Right Under Your Nose campaign. And if none of you ever had the pleasure of meeting Dr. Gimeno, you'll get to see a video of him. But to me, he was the Laurence Olivier, and when he speaks, you listened. He was a pioneer. He stuck his neck out, and I think it was probably 10, 20 years ahead of his time. I think when it's all said and done, from a public health standpoint, he's bigger than the field of sleep medicine. He's bigger than his clinic. He's bigger than his university. He touches every kid in this country or in the world when it comes down to it, because there's a sleep component that we all have. So thank you for your time, and thank you for our sponsors for letting us host this event in such a beautiful setting, in such an important setting. Thank you for our patient partners for helping us disseminate the survey and for sharing on social media. And we welcome all of you to continue to collaborate with us and figure out ways we can keep continuing helping our patients, either diagnosed or undiagnosed, or wherever they're at along their journey.